Tuesdays, virtual media briefing with the Mayor of London, Ed Holder, and the Medical Officer of Health for the Middlesex-London Health Unit, Dr. Chris Mackie. As always, we welcome listeners who are tuning in on Global News Radio, AM 980 CFPL, and viewers on Rogers TV in London, and also on the Rogers Facebook page and Rogers YouTube channel. And a welcome also to those tuning in on the CTV London website this afternoon. We would ask that the media who are in attendance today submit their questions in the question and answer forum in the platform here on Microsoft Teams. And also a reminder that we will go until 2:30 this afternoon, or earlier if we do not have all of the questions. But I don't think that will be an issue today. We've already got 3 lined up. So let's start right away. Mr. Mayor, we'll open with you this afternoon.
Well, thanks very much, Dan. Look, I think it's important that we measure milestones. And one of those actually is tomorrow, because we'll be acknowledging Doctors' Day or National Physicians' Day across Canada. Not just in honor of Dr. Mackie, obviously, but certainly all physicians. We paid a lot of time and attention honoring our frontline workers, in particular for the tremendous work and sacrifices that our physicians make on the front lines. So as a small token of our acknowledgement at the request of the Ontario Medical Association, I'm pleased to say that the City of London buildings will be illuminated in light blue. That's going to happen on Friday night and right through till Sunday. And certainly Londoners can show their appreciation as well by posting messages of support on social media with the hashtag Doctors Day, or by visiting doctorsday.ca online. But speaking of doctors and frontline workers, I want to touch on LTC funding, the London Transit Commission. This is a serious issue. We know that many workers in the health sector rely on the LTC to get to their place of work, and we need that talent more than ever, which means that transit must be protected at all costs. But these costs, however, are simply not within any municipality's ability to absorb in the medium to long term. So based on record estimates, the recent estimates, the LTC is looking at a $12 million shortfall by the end of August. And that's due to fares-free service, which was established in mid-March, and increased costs associated with hygiene, additional bus cleaning. And we've learned as of last night that the LTC has already drained now 2 reserve funds to deal with the shortfall. As part of the decisions yesterday, that plans for increased service hours in the fall have been put aside for now. And it's why London and all municipalities across Canada under the Federation of Canadian Municipalities banner are continuing to press for a minimum $10 billion injection of cash and emergency operating funding, and that is short term. Canadian municipalities need this operating money so that they can continue delivery of essential services. And that includes public transit. While we try hard to keep people safe during this pandemic, I said time and again, no municipality can do it alone. We are the front line and the bottom line. So we're grateful for what the federal government has done, the provincial government has done today. We're asking for a bit more to help us work this through. Final piece. Yesterday, some big news. Glenn Pearson of the Food Bank made an announcement at our Social Impact and Recovery Task Force that he will be heading up a particular component of food related to lunches that will be served daily through various frontline agencies. We have the cooperation of the RBC Place, the former convention center, now RBC Place London, as well as a significant donation from Cargill. That partnership allows them to do this for the next 3 months. This has been well received by support agencies, but it's another example, I think, of Londoners working to help Londoners, and particularly at this particular moment in time. With this crisis, this could not be more welcome news. So there will be no cost to frontline agencies. They'll just need numbers to provide to the food bank. That's who we recommend they go to. Glenn will then take that information and ensure that that food either gets delivered or can be picked up through RBC Place. And it's one more way we can help support London's most vulnerable. So bravo to them for their efforts. Over to you, Dr. Mackie, please.
Thanks very much, Mr. Mayor, and congratulations on everything that you and partners have been able to pull together. Unfortunately, we have some breaking news to announce today. There has been a case of coronavirus associated with a local business. Normally, these are not significant events, But in this situation, it was a food handler at a superstore on Oxford at Gamage. And the issue there is the individual actually worked for 2 days while they were symptomatic and preparing food. The food prepared was bread. This is bread baked and sliced in-house, so it wouldn't be related to branded bread coming from outside of the facility. But if you have purchased bread at Superstore at Oxford and Gamage, and that was bread that was produced in Superstore, please discard that. The risk is very low, but it's not zero. So we would ask that anyone who's got that food, please do discard it. If you happen to have eaten the food and also actually even just bringing it home, there's a small risk of contact with the coronavirus. Please do monitor yourself. You don't need to seek testing if you haven't got symptoms, but any symptoms at all, respiratory symptoms, cough, fever, shortness of breath, of course, but also other symptoms. We're learning more and more that coronavirus can have a wide range of impacts, including gastrointestinal symptoms, nausea, vomiting, diarrhea. So if you have any new symptoms and you've been in contact with bread purchased at Superstore over the last 3 days or so, then please do discard that bread and get yourself into one of our assessment centers. Best place to get tested for coronavirus, as always, is at our 2 assessment centers. Carling Heights is open 11 a.m. to 7 p.m. 7 days a week. Oak Ridge Arena is open 11 to 7, Monday to Friday. Getting back to our numbers, locally, we saw 9 new cases of coronavirus reported. 8 of those were in long-term care or retirement homes, and 7 of those cases were in long-term care. So of our 9 cases, 7 were in long-term care. Across the province, 437 cases diagnosed in the last 24 hours. The unfortunate number from the provincial counts is the death count. There were over 80 deaths in the last 24 hours due to coronavirus, which is actually our high water mark by far. We haven't had anything really substantially above 60 deaths per day. So unfortunately, we are seeing the case counts continue to decline, really almost a week-long decline in case counts, but the death count is not. Locally, we only had 1 death over that 24-hour period. It was an 80-year-old gentleman who was in hospital at the time. That's it for me. Dan, I'm happy to take any questions.
Thank you very much, Dr. Mackie and Mayor Holder. All right, the questions are in, so let's get to them right away. The first is for Mayor Holder, and this is from Dan Brown at the London Free Press. Mayor Holder, the coronavirus was declared a global pandemic on March 11th. As we enter May, how is morale among city staff and council members?
Well, I think like any group, particularly those that deal with this on a regular basis and a daily basis, challenging information that comes through, it's not something I'm sure that any council member or even civic administration anticipated would be something we would have to deal with. But I think generally morale is strong. I would tell you that one of the factors for that is that we have the Emergency Operations Center meetings daily. What that does is that we hear from our key professionals in each area. It's always led off by Dr. Mackie, and we hear from our chief of fire, police, EMS. We hear from the hospitals, get status reports from our different departments, our transit commission. And I think because we share that information well, and I think this press conference is an example of sharing information well. I think we work from the premise of pretty complete disclosure. And I think that gives people confidence. I think generally people are a little tired of this, if I could be candid, in the sense that, as nice weather comes out, people just want to go out and hang out with friends, hang out with family. And we have been week after week after week asking people to continue to self-distance, to ensure that they keep not only their space, but that they are mindful of crowd limits. Dr. Mackie's been brilliant that way in terms of ensuring and reminding people to do the same thing. So the messaging has been clear. I don't think there's any equivocation about the message, but I would say to you, people just are probably getting a little weary. And as we come up to, as I say, to good weather and the like, people would love to have the new normal back to the old normal, but we're asking people to commit to the same effort that we've asked them to do for the last several weeks. Don't let all that effort go in vain. Let's beat this to the ground and do it together.
Thank you very much, Mayor Holder. Dr. Mackie, the same question to you from Dan Brown at the Free Press. How is morale among health unit staff, and what is your sense of the state of morale among frontline workers in the health sector?
So, health unit staff are pretty grateful to be working, to be able to try and make a difference in their community. We've had lots of support from the community, which is fantastic as well. I think in general, people in healthcare are, again, happy to be working and also stressed because the work is that much more challenging with all of the changes and the new information and the challenges that we're facing. There's always a concern, of course, as we go home to our families, that those of us on the front line may have had some kind of contact that might put families at risk. So that's something that I think is pretty stressful for everyone.
All right. Thank you very much, Dr. Mackie. All right. Here, the next question is for both Mayor Holder and Dr. Mackie. Mayor Holder, why don't we go to you first? Now that it appears we are over the worst part of this pandemic, there will be pressures to start to open up the city and the region once again. Are you going to act in concert with the province, or do you think that it will make that you will make some decisions based on what is best for London and the surrounding area? And a follow-up, what areas do you think need to be addressed first? So first, Mayor Holder, and second, Dr. Mackie.
Well, I appreciate the question because it really is at the heart of what we're doing. It's why when the province of Ontario declared the provincial emergency and then we followed suit shortly after, it was because of the recognition of how serious the issue is. As far as things that are opening, we heard just this week the provincial declaration. The Premier announced that community gardens would be opened, and I think that's an important step. We will be looking to the medical officer of health for some guidelines around that, but that's an important step. We know that the Premier announced again within just a few days ago the notion of staging in this recovery, effectively creating a roadmap as to the things that would have to take place. Look, we are guided by the direction of the province, and municipalities are certainly creatures of that. But what's most paramount to me is the health and safety of Londoners. And if there's any part of the statistics that are different provincially versus municipally, then I would suggest that London will respond accordingly. Right now, it's more for Dr. Mackie to comment about the medical statistics, but I will say that they seem promising, and yet we are still being very clear about what can and cannot be opened. So we'll stage this in as appropriate with the safety of Londoners in mind.
Thank you very much, Mr. Mayor. Dr. Mackie.
Yeah, no, not much more to add. The province has been making decisions that are in general very well grounded in the evidence and in the data coming out from the healthcare sector. So I think that there would be very few situations where we would have to vary significantly from what the province is directing. In terms of areas to open up first, community gardens are a great step. I think other things like that, you may see, provincial parks opening up, potentially other parks and amenities, the sorts of places where it's actually quite feasible to practice safe distancing and to keep your distance. And, right now, the more green space we have, the better. There are lots of people trying to get outside and we have some congestion in some paths. So if we're able to open up more paths, that actually might be a benefit to some degree.
Great. Thank you very much to both of you for those responses. And that question came from Steve Young at CTV London. Dr. Mackie, the next question is for you. Another question from Dan Brown at the London Free Press. Dr. Mackie, you've been tweeting about mental health recently. How can Londoners keep their mental health stable in a time of isolation and interrupted routines?
So, yeah, it's really important to be thinking about mental health. It's a crucial part, not just, mental health is in itself something that can be really difficult, but also your mental health impacts your physical health. And it can impact your motivation, your energy level, all sorts of things. So taking care of your mental health is important now, as always. The things that are most helpful for taking care of your mental health are, all the things that mom told you to do. Get a good night's sleep, eat regular, healthy, balanced meals, get exercise in, particularly aerobic exercise. If you can get in half an hour a day, that's golden. It can be difficult to limit stress, but anything you can do to keep your stress levels to a regular, sort of relatively balanced level can also help improve your mental health as well. Everybody should look for what exactly works for them. I find that meditation and certain very grounded physical practices like yoga can really help my mental health as well.
Very good. Thank you very much, Dr. Mackie. All right. The next question, Dr. Mackie, is for you. This is from Colin Butler at CBC London. Dr. Mackie made some comments on London Morning on CBC Radio today about small family gatherings. He said, if it's happening in your home, there really isn't a prohibition. It's more of a recommendation to minimize those. So you got to make a judgment call. If there's a new baby in the family or some other significant moment, it might be worth having those small gatherings. And then Colin goes on to say, bylaw enforcement says they won't enter people's homes, but they say they will ticket gatherings in the backyard. This is really confusing. Why do authorities seem to be sending mixed messages?
Well, part of it is the pragmatic limitations of legislation. It's pretty difficult to not only enforce, but to legislate inside people's homes. So there's a limit right there. But also, the recommendation hasn't changed. Limiting your gatherings is the safest thing to do from the perspective of preventing coronavirus. And anyone who doesn't think they can even have a small family gathering without putting themselves and others at risk, if small kids who might be, not necessarily able to respect physical distancing measures, that could be a factor. The size of the home, all sorts of things. And also, people need to take their life circumstances into account. I am not going to say to people, you should never visit loved ones. As much as that's the recommendation from a public health point of view, there are all sorts of other things, including mental health and well-being, that people have to take into account. Absolutely keep those to a minimum, and the recommendation remains, don't have those gatherings. And beyond that, you can know that there is not, going to be guns blazing enforcement inside people's homes.
Thank you very much, Dr. Mackie. All right, the next question is from Sawyer Bogdan at Global News Radio, AM 980 CFPL. And this is a question about contact tracing about the Superstore's coronavirus case. How concerned should customers be? Will you be directing the Superstore to provide more information about when the employee worked?
Yes. So the risk to people that have shopped at Superstore is very low. Even if you did purchase some of the bread that was prepared by this individual, the individual was working on April 25th and 26th. So it's really bread prepared then that would be the issue, and it's prepared in-house. So, I happened to be at Superstore yesterday. I purchased that exact Superstore in Oxford. I purchased a loaf of Wonder Bread, 100% whole wheat, just for the record, that was prepared remotely. And that wouldn't be a risk at all, and so we're not disposing of that. But if you purchase something that was prepared at Superstore, some bread that was prepared at Superstore April 25th or 26th, that should be discarded. and do monitor yourself for symptoms. I'm also going to place an announcement on the board for today that gives you the website that we've created that has all the information about when the person worked. We'll get as quickly as we can what sort of bread brands would be affected or not, and it'll be at healthunit.com, and I'll place the exact the exact web address on the announcement page for this call.
All right. Thank you very much, Dr. Mackie. A follow-up question for you from Sawyer once again. As the weather gets better, is there any concern about more people heading outside and not practicing physical distancing? What things should people keep in mind when going out for a walk or being out in the open?
So in terms of getting outdoors right now, it's really all about whether you can still keep your distance. Absolutely, the weather is getting better. We do expect and understand that people will be getting out to get some exercise. Please take all steps to make sure that you can keep, at least 6 feet away from people, and ideally more when you're getting outside and considering the wind as a factor. It will be harder for some people than others to make those trips outside without being in close contact with other people. And so we just ask that you do your best to keep separated as much as you can.
All right, thank you very much. Another question from Sawyer Bogdan. There are 4 long-term care, let me just back that up there. There are 4 long-term care staff cases announced in today's count. What can you tell us about these cases? Do we know if they were all from the same facility? With the staff testing positive, is there a greater risk to residents? Is it in a facility that already has an outbreak?
So the individual today, the 4 long-term staff cases, what can you tell us about them? So I'm not entirely sure about, is this about recent cases? We have had a number of cases coming in. Most of the cases that we're seeing now, both in residents and in staff, are because of the universal testing that we're doing of everyone who resides and lives and works in the long-term care facilities in the region. The 4 cases, I believe that the ones you're talking about are the most recent cases, and those would have been distributed at a number of different facilities. We have worked with people in long-term care and in the healthcare sector to look at each home carefully, to look at what are the risk factors in the home, whether it's personal protective equipment or that may not be available, infection control practices, how closely are people able to implement the best practices there, or whether it's an issue of human resources that might be in tight supply. How can we help each of those homes, and then what risk level are they at? And we've got a sort of a red, yellow, green risk stratification, and all of the homes that have been deemed to be at risk have had intensive support from the healthcare system, from public health, and making sure that they have everything they need to be successful in protecting their staff and their residents.
All right, thank you very much. Dr. Mackie, we did get a follow-up question from Colin Butler. This was on the celebrations in homes and questions about the in the yard and bylaw enforcement. So his question is, so are you saying it's okay as long as you don't get caught?
So if you have to ask the question 3 times whether it's okay to gather in small numbers in your home, then the answer is no. Yes, it is something you should be thinking very carefully about before you do. And if you need a simple answer, it's easy. The answer is no, don't gather. And if you can look at things carefully, if you're not involving elderly relatives, small children who might be, have a hard time with physical distancing, making sure that there's no shared food, no shared beverages. These are things that you can do to try and reduce the risk of such gatherings. It's never something we're going to recommend from a public health perspective, but you can also take steps to make it very low the risk.
All right, thanks very much for the clarification. Dr. Mackie, Steve Young has another question. This is to the superstore situation at Oxford and Gamage. Have other employees who may have come in contact with this positive individual self-isolating?
Yes. So anyone who is a close contact of this person would be self-isolating. This includes some people who would be contacts from the work environment, but really we're talking about significant face-to-face contact. The risk of a brief sort of walking by in the aisle sort of thing is really extremely low. You have to have an adequate amount of the virus exposed to your body in order to get sick, and that is very difficult to do unless you have prolonged face-to-face contact. So we're talking, depending on the guidelines, 15 minutes to 30 minutes of speaking with the person in close contact and or being around them when they're coughing, sneezing, that sort of thing. It's not a very, very brief casual contact. And so even in a place like Superstore, where you have a number of employees, it would only be a small fraction of those that would meet the case definition for a close contact.
All right, thank you very much. That has been a lot of questions in the half hour this afternoon. We're just about out of time. We don't have any more questions, and the day has, we just got another question just in under the wire. Sawyer Bogdan, Dr. Mackie, are you testing other employees at the store?
Yeah, so there have not been any other employees at the store that required testing. So I mentioned that there are, individuals that are isolating because of close contact who are other employees at the store, but none of them have had symptoms which would justify testing at this point.
Great, that is reassuring. Thank you very much. Okay, we are out of time just about, but we are out of questions, gentlemen. Thank you once again very much for your participation today. And we also thank the media who responded to our question yesterday about the usefulness and how you find that these briefings help you in gathering the stories that you share with your audiences in London. We thank you for that, and we are taking that under advisement. And we will see you tomorrow at 2 o'clock for tomorrow's Friday's daily virtual media briefing. Have a great rest of the afternoon.
Been able to gain some skills since coming onto Rogers TV. Like, I've been able to operate a switcher in a control room. I've been able to now become a good audio personnel, so it's really a good experience. The big goal for me is to be able to be working at a professional hockey level or professional sports in general. I want to be able to be like a jack of all trades, directing, producing, all those types of levels of being behind the scenes in television.
Hey, did you know?
More than 4,500 Canadians are waiting for an organ transplant right now.
Right now. 4,500.
People are dying.
And you could save a life. 90% of Canadians say they're willing to donate their organs.
But only a few are registered.
So what are you waiting for? Get registered.
It's easy and it's free.
Leave a legacy. Be a hero.
Save a life.
Find out how to register today. Go to kidney.ca.
You're watching Rogers TV.